welcome to Medical Trade Fair. Welcome to Evo Training Institute, official partner of Medicare System. I'm Lara Lamin. I'm an occupational therapist and specialist in safe patient mobilization. Today, I would like to explain to you why it's important to use assistive products, because manual systems reduce the effort required to perform this common task, preventing injuries to caregivers and improving patient safety and comfort. We will show you how we can use the medical system devices in a proper way and in an effective manner to improve the quality of care. There will be two parts, a short introduction and a workshop. Okay. To start, it is important to know that before mobilizing a person, the preventive measures help us to avoid musculoskeletal system injuries, especially in the lower back. So don't force the posture because will contribute to a greater biomechanical overload. Use assistive products and contemplate the possibility that the person could collaborate with you. According to Bedside Mobility Assessment Tool, there are 4 levels of mobility. So first, we need to evaluate the patient's capabilities, because depending on the mobility of the patient, we will use some assistive products or others. Today, I will show you these devices. This is the minimal lifting equipment, and they stand out for their adaptability, durability, comfort, and security. They can be used easily with less effort and more security. Rigid board, pull and grip band, rotation disc, lower left band and mobilization belt. So the minimal lifting techniques are oriented to reduce the load lifting, and with medical system devices we can do it because the use of a good techniques and the right product allow a secure execution of the mobilization task. So how we can transfer patient between beds? This is the rigid board MediGlide for horizontal lateral transfer of patient between bed or stretcher, operation table, X-ray table, etc. with lightweight material, with sliding upper face and non-slip surface on the back. Support a separation between the surfaces of up to 20 centimeters and a slope of up to 20 centimeters. The patient can be transferred safely and comfortable by only 2 caregivers and requiring minimal effort. It used combining with the sheet for wet environment makes an ideal product to transfer patients to bathtub stretchers. In this video, you can watch the use of MediRoller Pro, using a bed sheet to provide greater comfort to the patient and security. Later in the workshop, I will make this transfer without the bed sheet to show you the effect of the tubular sleeve, the orange material, the tubular sleeve. Also, MediRoller Pro makes it possible to move the patient laterally in a comfortable and safe manner, without the need to lift them and with very little effort. It consists of a compact padded, lightweight and highly resistant core, featuring a super sliding finish on its surface to reduce friction with the tubular sleeve. It's a very good product. Pull and grip band, this auxiliary device for bedridden or wheelchair users. It can be anchored to the bed frame or another safe point, with 6 bands of different color for the patient to clearly identify where to hold on to. This is the rotation disc, which facilitates the rotation on a bed, chair, or car seat, with soft padding on the upper side and non-slip surface on base. This is the lower leg band that provides an extra grip, support, and anchoring point at the bottom of the person's legs. Very useful in transfer and mobilization tasks that require the patient legs to be moved. For example, when helping them get out or get into the bed, or when blocking their legs to stand up, or sit down. This is the Wharton seat board designed to transfer from bed to wheelchair, chair, armchair, or vice versa. Significantly reduce the effort required by the caregiver, made of sturdy but adaptable material to make it more ergonomic and safe, with a sliding upper face and anti-slip surface on the back for more security. The mobilization belt, the extra grip provided by the handles of the mobilization belt, enable the therapist or caregiver to handle the person in a controlled and safe manner. Transfer tasks are possible with less effort and increased safety, and with easy and quick application by adjustable clip. Further, with mobilization belt, we can promote the patient's walk. And this is the rigid turntable, safe and controlled turn movement in transfer that require rotation. Both the upper and the lower surface are non-slip to ensure maximum stability and more security. Okay, thanks so much for listening to me, and don't move because we continue with the workshop. Hello again, welcome to the workshop. In this workshop, we're gonna do two parts. One part, transfer between bed, stretcher bed, operation tables, X-ray tables, etc. And the second part of this workshop will be transfer bed to wheelchair, wheelchair to bed, and etc. So, to start, I would like to explain to you biomechanical and ergonomic solutions to prevent injuries to the musculoskeletal system, also to transfer patient, safe manner, more security. This product is the sliding wet environment, and it's so useful to transfer patient from bed to bathtub stretcher. So we're gonna use it in only 3 steps. Luis, my partner, helped me to do it. You can catch this part.
I have to need the board.
Yeah. We're gonna use to do it this board, the Mediglide. Lateralize a little bit the patient, okay? And then push. That's it. You can remove the table because the table has handles to remove it easily with less effort and more security. So this is the sliding wet environment. Again, to transfer the patient from stretcher to bed, the posture is so important. Don't flexion the back. So use the muscle, the abdominal and leg muscle during transfer task. 1, 2, 3. Okay, and I remove it easily with less effort. To remove the sliding wet environment from a corner and diagonally, without effort for the healthcare professional and without friction for the patient. The next product that I want to show you is that the MediRoller Pro. Is board, rigid board to transfer patient with the tubular sleeve lightweight and padded compact, we can use it. Okay. This point and this point, it's so important to lateralize a patient. The feet inside the table, and then my partner push me. Push to me the patient, okay? And then we move the table. Are you okay? Yes? It's so easy, the transfer between surfaces with the rigid board and the MediRoller Pro. Again, we're gonna repeat. I cut from here, from here shoulder. My position, it's so important, don't flex the back. Okay. Feet inside. Left. Okay, I'm gonna remove the stretcher. Okay. Now, I wanna show you other assistive product to get up the patient. So, if the patient needs to get up, we have the pull and grip band like this, some cord in the frame of the bed with different band and different color to identify the color. Okay, puedes agarrar el otro y puedes ir vale, that's it. Ahora puedes usar. So useful to get up the patient and to promote the autonomy of the patient. But if the patient cannot do it, we can use other assistive products like swivel cushion and lower leg band. Okay, this is the swivel cushion. If the patient doesn't have strength in his arms, we can use this rotation disc to help move his hip. So, un poquito arriba. Ahí, ya está. In combination with a little translite and in combination with the lower leg band. Sube un poquito las piernas. Sube un poquito las piernas. Okay, what I want to do? I want that the patient will sit down at the edge of the bed. So, I'm gonna use the bed remote to lift him here. Are you ready to sit down? Yes. 1, 2, 3. Okay. So the rotation disc help me to move his hip, and the lower leg band help me to get down his legs. So now to remove the swivel cushion, we're gonna do this way, a little bit. Okay, that's it. Your hand and your hand. Okay. Are you okay? Comfortable?
Yes.
Yes? It is important that the patient touch the ground. So we're gonna down the bed. Okay. We're gonna do the transfer to bed to wheelchair. It is important to stop the wheelchair for both sides, wheels, turn wheels, to remove this arm. And for this transfer, I'm gonna use the board on seat. This board on seat, super sliding on surface and non-slip on the back. It's ergonomic material. There are 2 rails, and we can play with this side or the other side for more security. So to introduce the table, the board on seat under his buttocks, we need to do hold. So only with this movement, his buttock rise from the bed, and I can introduce, that's it, the board. Okay, that's it. So now the posture, it's so important to do the transfer in a proper way without risk for my body, essential for my lumbosacral thorn. So the posture in a proper way is that, and okay, your hand here, my foot between his legs and the other looking at wheelchair, and at 3, come on, 1, 2, 3, okay. That's it. To remove it, the hand here and okay. That's other way to do it. It's depend of the mobility of the patient, of the person. So we can use the board on seat with the mobilization belt. Puedes sentarte aquí otra vez. This is the mobilization belt. It's a very useful aid with adjustable clip. With extra grips, and we can do it the same. One hand at the edge of the bed, the other hand here, and with this movement, okay. Now you can touch my belt, and now 1, 2, 3. That's good. If the patient has less autonomy, we can use this mobilization belt on him. ¿Puedes sentarte aquí? Vente un poquito para mí. Okay. The other. Are you ready?
Yes.
1, 2, 3. That's okay. Are you okay?
Yeah.
So, lastly, we're gonna do the transfer to wheelchair to bed. And we're gonna use the mobilization belt, the mobilization band, and the rigid turntable. The feet of the patient inside the rigid turntable. I put the mobilization belt. And the mobilization band goes to hug the sacrum of the patient. But it is important before to mobilize the patient that we need to know that the patient has strained leg. If not, we're gonna use other product such as crane because it's depending of the mobility of the person. So in this case, we can use this equipment because the patient has strained to a standing position. Okay? Vente un poquito hacia el borde. It is important the patient has at the edge of the wheelchair. Okay. The back from me to avoid lift him. And hugging the sacrum. 1, 2, 3. Okay, that's it. A little bit more. Are you okay?
Yeah.
Are you comfortable? So, it is enough for today. If anybody has any doubt, please ask me. I will be glad to answer them.
Thank you very much for your presentation, Laura. Now it's time to answer to the questions made by the people. I'll copy paste them on your screen. Please go ahead, Lara.
Okay, thank you, Pascal. Okay, first question. How many kilograms does the Roller Pro board support? You can use the Roller Pro up to 200 kilograms. Second question. Hello, Lara. Can the ladder be attached to a non-articulated bed? Thank you. Yes, sure. It is especially for non-articulated bed because the pull and grip band encourage patient to get up and to sit down at the edge of the bed by himself. So it is especially for non-articulated bed. Yes, absolutely yes. Question 3. How much does the Roller Pro board weigh? And how many tables do you recommend it in an acute care unit? How much does the MediRoller Pro? The MediRoller Pro weighs less than 1.5. I recommend 3 MediRoller Pro because one for use it, other if the board gets dirty with blood or fluid, and other if breaks the other. So three at least is okay for one unit. Hello from Germany. I have a lot of elder patients with poor motor skills, and it is difficult for them to get out of the van when we out the home care. Do you think the rotation cushion could help us? Of course. The swivel cushion. Yes, it's an incredible product to rotate the trunk and the hip and the leg and at the same time. So yes, I'm sure that when you try it and when you see the properties of the swivel cushion, it will help you and help your patients to move in getting in a van. And what happens if a patient does not have strong in his arms? Could we use the transfer board in a sitting position? Thank you, Lara. Yes, but it is important first to evaluate the patient's capabilities and mobility and motor skills to know what is his mobility capabilities, So you can use the Wharton seat in combination with the mobilization belt and to move him without effort. So yes, you can do it. And no more questions. Okay, so thank you so much. It has been a pleasure. So take care. See you again. So bye bye. Thank you so much for connecting live.